the register of the empaneled providers. SHA has already written, SHA has already withdrawn user rights for Cholof healthcare professionals who are implicated in criminal schemes and will be surcharging facilities to recover any monies paid based on the fraudulent claims. We have a duty, and myself as a minister, I have a duty, but together with my team, we have a duty to pay only for services legitimately rendered and to hold those who seek to defraud the system accountable. Further, in accordance with the Section 22, subsection 4 and 5 of the Medical Practitioners and Dentists Council, CAP 253, penalties for facilities who operate premises that are not licensed or employ or engage services of medical practitioners or dentists who are not registered or licensed include fines of up to 10 million or imprisonment for a term not exceeding 5 years. Again, it's our duty to ensure that quality service and care are provided to all Kenyans and that we guarantee patients' rights and patients' safety, which is a duty of this ministry and the government of Kenya. For the first time, and I really want Kenyans to listen to me, for the first time, we have a comprehensive digital system built on artificial intelligence and a big data fraud engine. Over the last year, since the rollout of Taifa Care, this system has collected a vast amount of data, giving it the power to detect, to analyze patterns, and to stop fraudulent transactions. Every transaction made by patients, doctors, or facilities is recorded in the system in real time. Today's submission of evidence to the DCI marks a critical next step in our fight against healthcare fraud. We have established a joint multi-agency investigation team with officers from the DCI, the Ministry of Health, SHA, KMPDC, and the Digital Health Agency. This team will work closely to ensure that all the perpetrators, be they facility owners, or doctors, or patients, face the full force of the law. Let me be very, very clear. Let me be very clear. As previously warned, any facility, any doctor, or any patient involved in fraud is now under the jurisdiction of our criminal justice system, who are present here today and will be prosecuted to the fullest extent of the law. We call on all Kenyans of goodwill to continue their vigilance and support in this fight against fraud. Please report any concerns or information regarding fraudulent activities to SHA via the toll-free number 147. Your participation is vital to securing a healthy future for our nation. That is the end of my statement. This press conference is very unique because the IG is here and his deputy and the DCI. So I'll hand over the files to them. They have left SHA, they have left the Ministry of Health. Now it's in the custody of the leadership of the National Police Service. And I think if anybody has a question about these files, the files don't belong to me anymore. Don't ask me any question, with a lot of respect to the media. I think you can follow it to the DCI along Kiambu Road and find the questions that you want to find. I have promised you I'm going to hand over, and I have done my bit, IG.
Thank you very much, Waziri. Let me start by saying, thank you very much, Waziri. Let me start by saying that this is a very, very important development in our country. Now that we want these government programs to work. Fight against crime, fight against corruption is a fight that police cannot leave any gap. And for that reason, the Directorate of Criminal Investigation is hereby directed to move with speed and ensure that all those people, every person, groups of people involved in the fraud against healthcare services are brought to book and they have their day before the courts of law so that they can be able to answer to the issues before them. Otherwise, I want to assure you, Waziri, that the National Police Service will continue to work very, very closely with the Minister of Health and the others so that we can be able to ensure that our country is free of these kind of challenges. And maybe I would like to call upon the DCI just to say what about this.
Thank you very much, CS. Thank you very much, IG. Mine is to join and confirm that we have today afternoon received a total of 1,188 files from the Ministry of Health. Just like the IG has said, as officers of the National Police Service, we value the importance of social health and its impact on our national security. And that's why we are here today, flanking the CS and assuring the country that this exercise will be taken very, very seriously. We shall investigate the matter very, very promptly and make sure that all the culprits are identified and prosecuted, regardless of their social status, regardless of their political persuasion. In addition to the prosecution, we are also bringing on board other law enforcement agencies to make sure that we identify and trace the proceeds and the instrumentalities of the crime, so that we start instituting the restitution proceedings. This juncture, perhaps we'll ask for the support from the ministry and the management of SHA, so that we're able to expedite our investigations. And as the DCI, we shall be providing regular updates on the status of the investigations as and when necessary. Thank you.
Thank you. Let me hand over.